Good afternoon, everybody. Thank you for being here. Hopefully you enjoyed the weekend. It was a beautiful, crisp fall weekend. We supported some Onondaga growing businesses, some local businesses. Let's go through some data, take a couple questions. No new deaths over the weekend. I think it's been over 2 weeks since we lost a neighbor of ours, and before then there was a period of time, too, that we had. So good news in our fight with the virus. Looking at some other statistics, we received back 1,160 diagnostic tests since yesterday. Our 7-day rolling average for diagnostic tests, 0.74%. In addition to these tests, you've heard us talk about it, but all of our local colleges and all of our initiatives are now using the saliva tests. So Syracuse, ESF, Upstate Medical, and OCC performed over 12,904 saliva tests over the last 7 days. So when we look at the positives that were generated from those tests, 39 positives came from the saliva tests out of our 104 cases over the last 7 days. So when you combine our nasal swab, our diagnostic test, and our pooled saliva tests, over 26,984 tests over the last 7 days. Our rolling average with all tests is 0.38%. So very good. Very, very good numbers. Looking at hospitalizations, 8 are in the hospital, 1 in the ICU. Let's keep them in our thoughts and prayers, but certainly our hospital numbers haven't been like this since late March, mid to late March. So this is very good. Out of those in the hospital, 5 are Caucasian, 3 are African American. When you look at cases, we have 16 new cases. We've had 4,041 positive cases since March 16th. Out of the 16, 3 were travel related. 2 were household contacts, 1 a group home, 1 still being traced, and then 9 were community spread. Out of the 9 community spread cases, 6 were from a known source, and 3 out of our 16 were related to college students or higher education students. Active cases, 188. Again, we expect, remember, 10 days before someone can leave isolation with improved symptoms, no symptoms for the last 3 days. So what you see is often 1 or 2 days you'll see big recovery numbers that will build up, and then you'll have big recovery numbers. So I think this week we'll see hopefully some big recovery numbers later in the week here. 3,653 people have recovered from COVID-19 in our community. When we look at our background of the individuals that have become positive with the virus, 2,318 are female, 1,723 are male, 400 under 19, 843 in their 20s, 527 in their 30s, 477 in their 40s, 599 in their 50s, 436 in their 60s, 316 in their 70s, 281 in their 80s, and 162 in their 90s. Our school testing began today. This is for symptomatic students and school staff. MBT Bank Stadium, 9 to 1. We've already tested over 50 individuals there today. This is the type of scenario to give you an idea what we're pushing. A child goes to school. His or her homeroom teacher notices that the student has a cough. The teacher sends the students to the nurse's office, who then contacts the parent. The parent tells the nurse the child has allergies. The nurse communicates to the parent that according to the health guidelines from New York State, COVID-19 must now be ruled out. So the nurse gives the parent the number for an appointment at Upstate. That number, 315-464-2582. You select option 2, and then you get a test scheduled for your child at MBT Bank Stadium. We then have very quick turn times, and there's a portal online that you can check as well. Any child under 18 must be accompanied. I've had some questions about county residents who are school district employees, but maybe a school district outside the county. Again, if they become symptomatic, that's fine. Just come to the MBT Bank Stadium. But the idea being here is to get in front of this and make sure that this will help us if there is a positive, get to contact tracing immediately. Also, it will help the process for getting your child back into the classroom, having COVID ruled out, so it's the least disruptive to your own schedule for that. So we're happy about that. This will be a tool when we have a case in schools. We've had cases, we've contact traced quickly, we'll continue to have cases. But this also then, if we wanted to see students in a classroom or in a school quickly go over to get tests, we utilize this as a tool. A couple other relevant topics. Certainly, you've heard us talk about government restructuring with the deficit that we have related to COVID. On Friday, we put forward our Phase 1 restructuring plan forward to the legislature. Again, this is not a position we want to be in or we're happy that we're in, but it's one that we need to do to help balance the budget in 2020, but prepare us for a 2021 budget. In addition to the already 460 positions that we have left vacant and or had through via early retirement, and the 200 part-time positions that we had already cut the hours back, we have further made moves with 86 positions. We had 35 new voluntary retirements. We had 19 compulsory furloughs. We had 11 voluntary furloughs. We have 14 more positions that have become vacant that we're holding, and we had 7 layoffs. Certainly not the position we want to be in, but one that is now necessary to meet the ongoing issues related to the pandemic. Into our last topic, I've always been one who tries to find middle ground. Recently, the Problem Solvers Caucus in the House of Representatives came out with their own plan, trying to find middle ground with the federal stimulus process. We fully support the Problem Solvers Caucus's plan as a way to hopefully break through some of the gridlock. Neither side gets exactly what they want, but a lot of people get helped out in the process, including state and local governments, which could help stop the bleeding here when it comes to the services that we provide and the fact that we're one of the largest employers in the community, and we are in tough shape, not because of decisions made at the local level. Saying that, happy to take questions.
How many positive cases we've had now in the local schools?
Schools?
Altogether, yeah.
Yeah. Let's see. We have had 6 students test positive, and we have had 2 teachers test positive.
And the 50 tested today, you don't have any results on those yet, I assume?
Not yet.
When a kid goes there to rule out COVID, they're instructed to stay out of school until they get
Correct.
the result back?
Correct. And then in addition to that, because they had symptoms, depending on what the symptoms were, they may need their own personal physician to have a doctor note to be able to get back to into the classroom as well.
Ryan, you mentioned Phase 1 got introduced to the legislature Friday. How many more phases can we expect, and what are some ideas on the table if that federal funding doesn't come? Yeah,
so right now, this generated the type of savings all the way through fiscal year 2021 that we think, assuming the sales tax payments. And again, right now, Josh, where we are is we're making decisions that we can control, and we're not counting on help. And we're at the point now where even if we get help, it's probably going to stop the bleeding. moving forward. One of the things that we focus in on a lot is the lost revenue related to COVID-19, but what is a very real and painful cut is the state budget cut of 20%. They have not called it a cut yet, but it's a 20% withholding of aid that normally we've received. We anticipate that to be real, even if there is help, because I don't anticipate that the state is going to get a $50 billion sum from any compromise, right? So we're factoring that into 2021. So really, the big date for us next is in October. In a couple weeks, we get another sales tax payment. If that payment shows us that it's moving in the same trajectory that we've anticipated, then maybe we don't make a move in October. And certainly then if we got some sort of help of any size, we probably don't make moves in the rest of 2020. But if that payment is going the wrong direction, we probably will have to make further adjustments.
Ryan, remind us, that 20% aid cut that's likely from the state, in dollar numbers, that's how much?
$20 million a year.
50 kids tested today at MBT Bank. Is that considered a good number, you think? Or it's kind of hard to, I know,
Yeah.
considering if they show up, they have symptoms, but do we consider that
Right.
a positive thing?
I think it's good. I think those are kids that otherwise would have gone to various testing spots, and some of the results would have been back in a day or two. Some of them would have been 3 days, 4 days. So we'll probably get them back 24 hours. So maybe even sooner, depending on the timing of it. I think it would be nice if there was no children there. And that's because nobody had symptoms, but we're going to flu season. So we know that as kids go back to school, especially if kids have been only hanging out with certain neighbors or certain family members, now they're seeing their friends again, inevitably there's going to be germs that are passed, and the runny noses and the coughs will happen, and now we need to rule out COVID. So this is a quick way to do that for families, so it's less disruptive to families, but also so that we can do contact tracing to find that one case that's going to pop up. Again, 6 cases of kids so far through the school year. We've been at it a couple of weeks, thousands of kids coming together. Those all fall in line with what we have with our overall positive rates in the community, very, very low.
Ryan, as this pandemic has played out, and a lot of people have lost jobs or lost hours at work, I assume that the stress on the social services department and maybe child protective and some of the other departments has probably gotten greater, right? Do you have a way to describe that, and is the pressure still on for those intake workers?
Yeah, so the workload in every one of our departments is not decreased whatsoever. To your point, it's increased in the human services world. We were probably a lean operation to begin with unemployment at 3.8, 3.9%, and we were surgically looking at ways proactively where we can help reduce poverty. Here comes COVID, and now we're at unemployment. We haven't gotten the recent numbers. The numbers suggest we'll probably be lower than the 13% unemployment. I think it comes out regionally this week, but we're probably still above 10%. And now there's less people doing work when there's more people that need help. So the challenge before our workforce is a tremendous one, and it will be moving forward. And it's tough to keep morale high when we're at a point where we are here, to keep people engaged when they're human. They are under a amount of workload stress. At home, things are different. They're living in a pandemic as well. They have families as well. And at the same time, I have to talk about fiscal realities of where we are. So all these complexities are part of the hit COVID delivers to us. But we have the most efficient and highly performing workforce in the history of the government right now, by far. And we continue to have that in 2021, and we'll get through it. We have to get through it. We've risen to the occasion collectively. and to help put our community in a position where we got through restart. We continue to address the threat of this virus to public health every day. We have colleges open and kids on campus learning, and we have schools open now. So our workforce will continue to meet these challenges, but I understand the toll it's taking on them. We're going to ask them to do even more in 2021 probably than they've been doing.
And on the client side, are you hearing about any, any services they've gotten behind on, they can't keep up with?
Not yet. I think we have concerns. I think, Tim, once you get some of everybody more comfortable living with this virus as time goes on, and rates are sustainably low, then you'll see maybe more pressure for in-person type services, and then obviously that becomes harder to handle. But using teleservices and whether it's telemedicine or online technology, we've incorporated this into all of our platforms as well. But it's not, I'm not going to say it's unsustainable, but it's going to be very difficult for us to continue to meet many of these state mandates when the state of New York is cutting us and our revenues are lagging in the timely fashion the way we want to. We aren't behind now, but I don't know next month or the following month I'll be able to say the same thing.
Ryan, you watching any football this weekend?
I watched a little bit of football this weekend, and certainly I'm excited about the home opener.
Well, that's what I wanted to ask you.
Yeah.
Hopefully we weren't going to dive into your fantasy team, but I did want to ask you, if you watched some football this weekend, you saw some fans in the stands. The Dome is allegedly done, supposed to have been done last week, and home opener this weekend with no fans.
Yeah.
Any indication as to when possibly there could be fans in the Dome? Like I said, we see other schools in states that have frankly handled it worse than we have fans in the stands. So for the Syracuse fans watching on the stream here, what can you say to them about possibly seeing a home game?
So we're talking to the state, and I know in Syracuse there's a lot of Buffalo Bills fans too, right? So I think that we're trying to figure out a way to have some people in the facility and do it in a way where it doesn't set us back related to public health. And so one way of doing that is testing, and rapid testing. There's some rapid testing becoming more and more available, and if we can grab some of that capacity, I think that's an easier sell to the state then, that you can have a percentage. It can't be, listen, we're not going to have 50% of the Dome for football this year, right? So, but can you get 10? Can you get 15, 20, 25? If you know everybody does not have COVID because they just took a rapid test within the hour before, I think that's a pretty good regulation. So as the technology evolves, I think it gives us these opportunities. And we're trying, Abbott's has new technology in this for rapid testing. We're trying to figure out ways to get that in the community. And then it's getting the state comfortable. And we're having those conversations. But I know they are having those same conversations in Erie County as well. Some rabid Buffalo Bills fans throughout upstate New York, and they're having a good year. So the pressure isn't going to loosen on the state to figure out a way to yes on this subject.
Ryan, it might be helpful just to do a recap on what people's options are for getting tested for COVID. Because I think Syracuse Community Health Center is still doing every day. They're doing universal testing.
Yeah, I'm not exactly sure, universal testing-wise, what the insurance is covering or not covering now. So I'm not comfortable saying to somebody, if you don't have symptoms, go there, because I don't know what's going to happen with your insurance billing. We're at a point I knew what was going to happen. So what you have is you have Syracuse Community Health Center, many primary care providers, Crouse, St. Joe's, Upstate's doing a lot of testing. Now we have the saliva-based test at Upstate, and that's what we're using with our proactive testing. That's what we're using with the rapid testing down at MBT Bank Stadium, but that's what we'll be using at first now for our asymptomatic testing that we're going to do in schools That's what's being used for asymptomatic testing at colleges. And so the saliva test is the dominant test in the community right now. And why can you do that asymptomatically? It costs a lot less in the labs right here.
So if you don't have symptoms and you have a reason to get a test, like you need to have a procedure or something, are the hospitals generally open for you?
Correct.
Or?
So that is covered by insurance if you're going to have a procedure. If you're a contact or potentially in a quarantine of a positive individual, again, that would be covered by insurance as well. If you're curious that you had COVID, right now I don't know what will happen if you go to Syracuse Community Health Center, if you'll get a bill in 60 days or 90 days. So I don't want you calling me up and yelling at me at my office the way it has happened. And so I won't say, if you're in that scenario, go to Syracuse Community Health Center. We're trying to come up with plans for asymptomatic testing the way we did earlier with our mobile testing units going into neighborhoods as we get further into the fall season so that we can look to see if we have any hidden clusters in different pockets and to offer that up again. But we still have planning to do. We're getting through school now, working on our screening protocols in districts right now. And as soon as we get more comfortable with that, then that will be the next step where we get our mobile testing unit going back out into specific neighborhoods and towns and villages.
Ryan, last thing I'll ask about football. With the dome being indoors, can we assume that guidance there is a little different than where the Bills play? Could that make it more difficult?
I think the state health department could suggest that. This is a brand new facility with brand new ventilation systems, so I think that is something that is positive. And again, if we know for the most part, right, every test there's some level of unknown, right? Diagnostic, I think it's 99 point whatever. But if you know everybody just took a test and was COVID negative, the need for physical distancing is a little bit less. And then if you're going to still physical distance in addition to that, you're essentially doing as much risk mitigation as you probably can do without just saying no. So if the mindset is let's try to find a way to yes, I think these are the types of steps that you can take to make a strong argument. Other questions?